Follow-up of the third cancer treatment and finding the fourth cancer spot.
Because it's radiation and I get it every day, all day long. You get it every once in a while, so not a big deal for you.
Positron emission tomography, PET, the injection of a radioactive tracer about an hour before the CT scan.
All right, let me go check it and I'll be right back.
Dr. Jameson Stroud, a board-certified radiation oncologist, reviews the positron emission tomography of the third treatment area and discovered another cancerous.
Upper abdominal bowel. This all looks good. This right here looks like ureter to me. Yeah, it looks like ureter. So we'll keep going down. So this is bladder coming in. Bladder. So here's the big mass in the prostate, right there.
Mm-hmm.
It's gone now.
Wow.
Yeah.
Yeah, it moved from the top and it went sort of to the bottom.
Yeah, it's gone now. So that site looks great right there. Because it was on the back of the prostate,
Right.
It's now gone.
Great.
Here's the problem. It looks like maybe there's some disease that was in his seminal vesicles on the left that's progressed and gotten a little bit bigger right here.
It's growing again?
Just in the seminal vesicles. So where we treated it looks great. You can see the back
So
here
that's
behind
not where the seeds are at. The seeds are way up on the top part.
these markers here.
Mm-hmm.
Yeah, that's down in the prostate, and then just above it is the seminal vesicle right here. I'll show you on this scan.
Mm-hmm.
So here's the profile. That's the sacrum, the flat bone in the back of your, in the bottom of your spine, your tailbone.
Mm-hmm.
This is the front pubic bone. And here's the bladder, and then there's that spot right on top of the.
How big would you say that was?
Right on top of the prostate.
Size of a quarter grapefruit.
So this is 1.2
1.2.
centimeters. So a little over half an inch. So if you put, it's 1.3 centimeters looks like. But essentially, you can think about it as about almost a dime and a half, about that. So I know you've been treated a lot. That's the only site that lights up.
Can you get hit again with
So I think it's reasonable to treat that spot since nothing else lights up. You know, I don't see any lymph nodes. I don't see anything in the bones.
So it's just staying there, staying put.
Just that one little spot. And it's definitely gotten bigger since August. So I think it's at least worth looking at the scan and trying to treat that. Putting some dose on that, seeing if we can get some good dose in there.
So back to Versa.
Yeah.
Okay.
So just looking at this.
Still encapsulated.
Yeah, it still looks like it's
Still in the prostate.
just above the prostate in the seminal vesicles. It's sitting right on top of the prostate. So the big question is, what kind of doses have already gotten to the bladder wall, and how can we spare that? And then rectal wall also, knowing that you've already had prior radiation. But if you had disease elsewhere, I wouldn't even consider it.
5 more treatments was ordered using SBRT Electa Versa HD at 600 grays for a total 3,000 grays starting December 12, 2024 and ending December 18, 2020.
Now, can you tell us what's going on? Just like that.
All saline. Just feeling around, making sure we're good.
You gonna wash it?
Just kind of making sure everything's going through. All right, be right back and then we'll take it all out.
Now the results of the PET. Dr. Jameson Stroud reads my medical history.
year-old gentleman with an initial diagnosis of unfavorable intermediate risk adenocarcinoma of the prostate, T1C, Gleason score 4 + 3 = 7 with a pretreatment PSA of 4.4. He completed 8100 centigrade radiation therapy on 10/2/18 and had androgen deprivation therapy between 2017 and 2018 under the direction of Dr. Kennison. He developed biochemical recurrence in August 2023 with a PSA up to 5.9, which is increased from 4.6. PSMA, subsequent PSMA PET scan on 9/5/23 showed focal uptake within the left side of the prostate. On 10/6/23, he completed focal SBRT to a total of 3,500 centigrade in 5 fractions. Subsequent PSA in October 2023 was decreasing down to 1.6. On 8/14/24, surveillance PSA came back elevated at 3.7, which was increased from 2.6 and previously 1.6. Subsequent PSMA PET scan on 8/26/24 showed persistent increased uptake in the prostate. He underwent additional focal SBRT completed on 9/13/24 to a total of 3,000 centigrade in 5 fractions. Subsequent PSA on 10/16/24 was 1.2, and on 11/29/24 was 1.1. PSMA PET scan for surveillance on 12/2/24 came back showing a 1.3 centimeter focal area of radiotracer uptake in the left seminal vesicle. Most recently, he completed SBRT to the left seminal vesicle on 12/19/24. And as far as androgen deprivation therapy, he resumed Eligard injections in August 2024 with his last 22.5 milligram injection on 12/2/24. Most recent PSA on 1/16/25 was undetectable at less than 0.1. And he had a PSMA PET scan today, which we're reviewing together. That was a lot.
Yeah, that is.
I think we got it.
What a history.
I know. All right, so let's take a look. How are you feeling, by the way?
Hanging in there with you.
Okay. Well, that's good. All right, so I've got your PSMA PET scan here. We're going to just get this down where we like it. I like to drag this way down here. Kind of make things shine for us. Okay, so you remember this is the whole body down here in this corner. This is a cross section through that blue line, so I can scroll. That blue line shows us what cross section the PET scan is here. This is a CT scan through that same level, and then we put them together up here. Things that light up normally, like the salivary glands, the lacrimal glands that make tears, the liver, kidneys, upper bowel, bladder, all that's normal. So we're going to start at the top here. Take a quick look at the brain. We got just the bottom part of the brain image. That all looks good. We'll keep going down through the head and neck region. These are just salivary glands. I don't see any enlarged lymph nodes or past the chin into the vocal cords there. That looks good. The thyroid gland looks good with no nodules. The esophagus is here behind the airway that splits there. The heart is right there. Esophagus drops into the stomach right there. That all looks good. This is the pancreas, looks good. The spleen looks good. The liver here looks good. Take a look at your lungs.
I was kind of concerned about them.
Oh, yeah, these are just normal blood vessels coursing through the lung here. This is the left lung. And that looks good. I don't see any abnormalities there. On the right lung, right here, same thing. Blood vessels. I don't see any nodules jumping out at me on the right lung either. So, yeah, so let's get down to the abdomen here. So, this is just some calcification in this splenic artery here. That white stuff right in there, that's fine. Pancreas is right here. Gallbladder's right here. That all looks good. This is the left kidney. It's supposed to blast out like that, so I like to look down here, make sure we're not missing anything. It's a little bit shadowed by your arms back here, but it looks good. I don't see any stones in the left kidney or cysts. Right kidney over here. Same thing, looks good. I don't see any stones or cysts. Well, maybe a tiny stone in here. Maybe. But it's not doing anything up there in the kidney. So we'll keep going down. I'm looking for lymph nodes in this area that light up. So there's some lymph nodes that are normal, like this right here and this, but those don't light up at all. Now the question is this one right here. Is this a kidney? Is this a lymph node, or is it coming down from the kidneys going towards the bladder? And that's what it looks like to me. It looks like a ureter, which is coming down towards the bladder. And you can see here, that's right there. That's on its way down from the kidney going towards the bladder. So that's nothing to worry about there. And these are just loops of bowel. Down into the pelvis, here's the bladder. So here we've got tailbone, rectum, seminal vesicles, bladder, hips right here. And the seminal vesicles look good. I don't see anything lighting up in the seminal vesicles. And then here's your prostate right here. That all looks good.
That was the marker seeds you just
Yeah,
went by?
those are the markers right there, exactly.
The 3 of them?
There's your gold markers, yep. 3 of them and a little calcification over here. So that looks good. So hallelujah, I don't see, this is a negative scan, meaning it's positive news. That's good. So no sign of any residual cancer or anything like that.
In remission.
In remission, yep. So the Eligard is doing what it's supposed to. The radiation did what it's supposed to. So the plan is to give you another shot today and bring you back in 3 months and check your PSA again. Make sure it stays undetectable. And go from there.
Okay. That was Dr. Kennison's office calling me.
Oh, okay. Are they doing your shot there? Or are we doing it here?
You're doing it
That's
here.
what I thought. Okay. And they're okay with that? Dr. Kennison's okay with that?
Yeah, I'll follow up with her on the 5th.
Okay. Because we usually let them do it, but it sounds like we've been doing it since August.
Yeah.
So we'll just keep doing it.
The only thing that you don't have is Xandy.
Oh, Xtandi?
Yeah, Xandy.
Okay. Yeah, you're getting that from the pharmacy?
Yes.
Okay.
And Dr. Kennison set me up with that.
Okay, perfect.
Now, you said 3-month follow-up.
Uh-huh.
You're going to give me a shot of Eligard with a 3-month follow-up.
That's right. And then we'll plan on giving you another shot as long as you're still tolerating it well in 3 months.
So we got another 6 months of hormonal therapy.
Well, it's kind of up to you. As long as you're tolerating it, I would continue it for a good couple years.
Wow.
Yeah, just because, it's come back a couple times there. But that's all kind of if you're tolerating it okay, and if you get to be like a year out and you're struggling with it and you're not tolerating it, then maybe we take a break and see what happens with the PSA.
Okay. So this is the hormonal therapy is taking a bite out of me.
Is it bothering you?
Not
Yeah.
bothering me. It's just like I'm a slug.
Yeah, it definitely takes it saps your energy. Yeah.
Okay. So that's normal.
It's dropping your testosterone, so your energy's low, your motivation's low, all of that.
So
Nobody wants their testosterone lowered. It's not a good feeling.
Okay.
But it shows it's doing what it's supposed to starve out the cancer.
Yeah. So if I'm in remission, we're doing good.
We're on the right track. Yep.
And it's worth being on hormonal therapy.
I mean, that's kind of a good perspective, right? It's cancer treatment. So if you're tolerating it, even if it's making you a little bit uncomfortable, if you're tolerating it okay, it's doing what it's supposed to.
And I'm a 4-time.
So far, yeah. We hope that's it, right?
So now we're in remission with the hormone therapy.
Mm-hmm.
And this is where you want me.
That's right. Right.
Okay. I'm having to explain this.
It's good. It's good. It's good to have the support of all your family, too.
All right, sir.
Good to see you. All right, so hang tight. We'll get you a shot today in the stomach, and then we'll get you back in 3 months.
All right.
Okay.
You're doing real good for me. I appreciate it.
Well, good. You're doing the hard part. We're just here to support you.
All right. Thank you.
All right.
There you have it, my journey from 2018 to March 3, 2025. My cancer is in remission and cancer-free, but it comes with a price of consistent monitoring along with hormonal therapy for the next few years.